As this winter storm continues to impact the Arklatex, hospitals are working behind the scenes to stay fully operational and ready for emergencies. And joining us right now is Scott Wolverton, Director of Emergency Preparedness for Willis-Knighton Health Systems. Scott, thank you for being with us during what I know is a very busy time for you. Let's start with the big picture, though, Scott. How is Willis-Knighton responding to this winter weather event?
Well, I have to say we're very blessed and been very fortunate to have more of a sleet event than a freezing rain event, so that helped prevent a lot of the power outages that could have occurred for our hospitals. We did have a couple of blips yesterday where we lost power for a short time at a couple of our hospitals, but it didn't prevent us from being able to provide service for our emergency departments, and we were able to get those on very quickly and continue those operations to help continue serving our people that are coming to ED and our patients that are in the hospitals.
Yeah, if it's foreseeable, it's preventable, you already had systems in place to allow for a power outage. Now, are you seeing an increase in weather-related emergencies right now?
We've seen some weather-related arrivals to our ED, but they have been very minimal. I had to kind of echo what everybody else is saying. A lot of people have stayed home. They took the advice. They took the pre-planning advice that a lot of our emergency responders and planners for our Homeland Security came out with in their press releases and their messaging. So I think that's helped prevent a lot of the overload that we would normally see from this type of event in our emergency departments.
What's the biggest message to the public during these dangerous conditions?
Well, from the hospital standpoint, is we're going to continue to do what we do as efficient as possible and as safely as possible. Try to continue as many services as we can. We still have patients in our hospital that we have to take care of. We know that there'll be those patients that we need to see in our ED, so we try to continue as many services as we can. However, we also want them to understand that there are some services that we will not be able to continue when you have road conditions like this. It makes unsafe for people to get to clinics or to some type of diagnostic testing that they were getting. And we ask them just be patient with us. We're going to get those open as soon as possible so we can continue those normal day-to-day operations that we would do here at Willis-Knighton.
And Scott, we just heard the mayor of Shreveport talking about the importance of clearing roads near hospitals so that people can get to dialysis treatments, for example. And you've got some experience with the fire department as well. Can you speak to that importance for us a little bit here?
Sure. So we've been communicating with the Emergency Operations Center since it's been open, and our command center's been open since 7 o'clock on Friday night. So we have clear communication with them. We're working with the Region 7 coordinator that's representing that, Mr. Knox Andrus. We have developed some travel plans to get some of those dialysis patients to the dialysis centers so that they can get taken care of because they've gone a couple of days without dialysis. So those plans they were being pre-planned. Now those plans will be implemented so we can take care of those patients.
Any anticipation on when things will get back to normal?
I think it's still going to be a wait and see. We'll be staying in response mode for at least a couple more days as we begin to thaw out tomorrow. As the temperatures rise to the 40s and upper 40s over the next couple of days, we'll continue to do what we do. Hopefully, get back to more normal operations from a travel standpoint. But sometimes you have water outages, and a water outage will affect the hospital very much, and we'll have to prepare to respond to that, and we will do that. We've already put a lot of pre-planning in place for that, so if that does occur, we are ready.
All right, Scott Wolverton, thank you so much for your time and all that you're doing for our community as well.